chipped, stained, or uneven teeth. Don't worry, veneers can help. Dental veneers are thin, tooth-colored shells that are attached to the front surface of teeth to improve their appearance. They can be used to treat cosmetic concerns like chipped, broken, discolored, or smaller than average teeth. Veneers are made from porcelain or composite resin, both designed to match your smile. Composite veneers are crafted from a composite resin material, which is directly applied and sculpted onto the teeth in layers. This process can usually be completed in just one dental visit with no removal of tooth enamel. If damaged, composite veneers can often be repaired with relative ease. Composite veneers usually last for 5 to 7 years and is more budget-friendly compared to porcelain veneers. Porcelain veneers are made from thin layers of porcelain, which are then cemented onto the front of the teeth. Their fabrication process is more intricate, often requiring a few dental visits before the final placement. When properly cared for, porcelain veneers can last upwards of 10 to 15 years, which is generally longer than composite. Porcelain has a smooth surface, making it resistant to stains from coffee, wine, and other common staining agents. The translucent nature of porcelain mirrors the light-reflecting properties of natural teeth, offering a more genuine look. On the flip side, porcelain veneers are generally more expensive, and the process is less reversible than with composite due to the need to remove a small amount of tooth enamel for placement. In just a few visits, veneers can give you a confident, natural-looking smile